explain what the EVOX system is to other doctors?
For me, the EVOX system is a tool that I have in the toolbox to assess the patient in unique ways that I don't have with other modalities.
Okay, I'm sorry. So even though he asked the question, if you
I need to look into the camera. Yep, you bet.
It's kind of strange to look in the camera.
Yep.
That's okay. Yeah, he'll do it. Dr. Hurdy, how would you explain what is an EVOX system to other physicians?
Well, for me, the EVOX system is another tool that I have in my toolbox to assess patients that really I don't have using other types of modalities.
Good. What are some of those outputs from the biomarkers that you gather that enable you to make a better patient management assessment and decision?
Well, I find that the system is extremely helpful to make decisions regarding medical management, either pharmacologic or non-pharmacologic, behavioral modification for the patient. For example, if I'm wanting to choose an SSRI for a patient, it can help me really optimize my initial upfront pick to make the greatest gains for the patient. In fact, I can avoid certain medications that would have an adverse effect for the patient. When I look at a patient, for example, that has attention deficit disorder, I very likely will be able to use a non-pharmacologic approach with that patient, and that's a great thing. I'm a cardiologist and I don't like the effects of a stimulant on patients, and if I can avoid their use, I will do it, and neurocognitive training is extremely effective for that type of patient.
Good. What are some of the components of an EVOX system that are being measured during the assessment?
Well, we're measuring the electrical potential in the brain, both evoked potentials. We're measuring cortical function of the brain. We're measuring sympathetic and parasympathetic output. And as a cardiologist, the brain is the master switch. And so I look at that as an incredible tool to make changes that really directly impact the health of the patient, even cardiac health. I also look at the gut as being an important player in brain health, and there's communication among the gut, the brain, and the heart. So I implement that in my practice among all those three domains.
Good. Throughout the month, you see a variety of patients. What are some of the patient types that you believe would be ideal for an EVOX assessment in brain training?
I think that it is, the list of patients is a mile long. You could use it for people who have troubles with depression, attention deficit disorder, anxiety disorders, PTSD, traumatic brain injury, people who just want to optimize their function. They are already fairly high functioning people and they want to be maximally high functioning people. I'm moving very much in the direction of health optimization, and so I think it has a great role there to improve people's health for long-term benefit.
Good. Dr. Hurdy, I understand that you used biofeedback and heart rate variability training to optimize your patient's health. Can you share some of the patient types that you have had success in treating with biofeedback or neurofeedback training?
Sure. We have had patients, for example, that are wanting to improve speech fluency, people that are competitive in debate, and we've trained Broca's area and greatly improved their ability to have rapid recall and fluid speech. It's improved their life that way. We've also had people who have issues with drug addiction and have dependence on polysubstance abuse folks, and having good success in helping them get clean and change their behaviors. Look at areas of the brain where we can, with supplementation, cool down inflammation and really help them get away from their drug addiction.
Good. Dr. Hurdy, if it's safe to say that you see patients with memory loss, when you get the EVOX report back, patient report back, what are you looking at in particular to identify the associated biomarkers that are related with memory loss?
Well, we're looking at a marker, a peak alpha. We're looking at other areas of the brain as to how well that brain is just working from an electrical physiologic state. And it's very helpful to know if a person is entering into areas of cognitive decline or areas of the brain that are just not working efficiently, communicating with other areas of the brain. And so it's very helpful to, in a way, compartmentalize areas of brain dysfunction, and it is useful in our patient population for those who are having cognitive issues.
Dr. Hurry, Dr. Hagedorn tells me that a low peak alpha wave or a slowed P300B wave are indicative of memory loss.
Yes.
How does that help you, getting that data help you as compared to looking at a standard MMSE, a mini cog, or a clock draw from a patient?
Well, for me, it adds another layer of information that to me is much deeper. It also may help change my therapeutic strategy. It also is going to take me to a point where I'm going to enroll some of the other providers of healthcare in my community that I want to enlist in this patient's care. I know now how to more specifically get them involved in other courses of therapy that I wouldn't otherwise necessarily direct them to.
Okay. What type of patients would you say are ideal for other primary care physicians to look for potential EVOX assessment?
You know, I think the brain is the master switch. Everything hangs off of that. So I can hardly not think of a patient that you wouldn't in some way find helpful with this type of diagnostic approach and therapeutic approach. For me personally, I look at it as a great tool for health optimization. I can really take the patient to a place where I couldn't otherwise with this modality. It's extremely helpful to help my patient with motivation, to help my patient treat their depression, their anxiety, to treat their addiction issues, why they have food issues. It motivates them to be compliant in their healthcare plan. And so I use it as a very comprehensive, one of the tools that we use, combined with blood, combined with education, to really encourage advancement in their health.
Good. Dr. Hurdy, when you first heard about an EVOX system, you probably, like many other physicians, didn't know anything about it. What are some of the things that you thought were important to learn about right up front, and what was it that caused you to want to buy an EVOX system?
Well, initially, I'll have to admit, I was very much a skeptic. I thought, you know, is it voodoo? Is it too good to be true? Can I believe the claims? I looked at some of the white paper literature. I began a mentoring process with one of the neuroscientists. I was blown away in that I would keep him blind and he could tell me information about the patient that I only knew. That was stunning to me. And I could see the reproducibility in the data. I also could see the changes in the brain studies on and off therapies. And so I really became a believer. It was amazing to me, the information that I could be told. And I also wanted to, I'm not a neuroscientist, but I wanted to learn this. And I wanted to make the effort to dive in and sink my teeth in it because I found it fascinating. And so it was a real turn on for me.
Good. Dr. Hurdy, for primary care physicians that are looking at an EVOX, what are some of the questions that you would encourage them to ask of the EVOKE neuroscience so that they get a full understanding of what the system is?
I think I would encourage them to ask questions about how is it going to help my patient population base. I think I would encourage them to ask, you know, where does the technology come from? That was interesting for me. That was part of what made my conversion over to believe it. I'm very scientifically evidence-based. I don't buy anything that's made up or voodoo. And so I would ask those questions, ask about the validity of the science, ask about the reproducibility, the sustainability of the therapy and the treatment. And those answers, I think, will convince folks. It convinced me.
Good. Thank you very much.
Can I ask a quick question, actually, maybe about